I'll just go ahead and say this. Painkillers do have an effect on back pain. It can and it should be a positive effect. But this can be a very slippery slope, as a lot of you may probably know. And they're not exactly the right solution you're looking for in a lot of cases. Even worse, they can lead you down a false path further away from healing and strengthening your back, your body, and your spirit. Let's just throw that one in there as well. My name is Mate from Real Deal Heal. This is not medical advice. I'm not a doctor, but I am someone who spent 12 years struggling with back pain, believe it or not. I learned a lot. I hope you learn a lot from my mistakes as well and from my victories too. I have the scars to prove it. I have the experience. I hope I help you heal faster and you don't take as much time to heal as I did, and you don't go through the same vicious, brutal pain that I did. And when it comes to your healing process, I do believe that painkillers should be an important stepping stone. But there's a lot of traps and pitfalls you need to be aware of, so keep watching and let's get into it. Let me quickly share my story first, tell you what happened to me and what mistake I believe I made when it comes to painkillers. So my back pain started with a very sudden initial episode. It was very vicious. It was very out of the blue entirely. I was just walking, having a normal day, and I had all of a sudden, like out of nowhere, I felt this really, really, really super strong, like lightning in my back. It was like an electric pulse, and I felt it like nothing I've ever felt before. It was almost like a steel barbed wire in my back, and I could barely move. I couldn't even like breathe. I had to sit down. I had to like spend a few minutes just to kind of relearn how to breathe, to be honest. And it was really bad. It was really brutal. I had to spend the rest of the day in bed. In fact, I had to spend the next several days in bed as well. And this is where I believe I made the mistake when it comes to painkillers. I did start taking a mild painkiller. This was like a general sort of analgesic, but this wasn't a strong targeted painkiller that's supposed to address back pain. And I believe this was a mistake. You see a lot of us, especially if you work in an office, in a chair, if you're a programmer like me, like I was for a lot of my career, chances are the root cause of what's actually hurting our backs is not exactly the mechanical injury. Doctors will disagree with me on this one. They will typically try to diagnose you with some sort of maybe herniated or bulging disc or some sort of a degenerative disc disease or sciatic or anything of that sort. And they're going to usually be adamant that you should only pursue paths that are commonly recommended to heal those types of injuries. And hey, like if you heal like that, awesome. Oh, more power to you. Like go live your life. But a lot of you may discover that that's not exactly the whole story. What happened to me was I kind of went through the entire journey of everything the doctors recommended and nothing really worked. So I had to kind of figure a lot of things on my own. And it turns out if you suffer from chronic back pain, which is this type of pain is complex. Chronic back pain is actually complex. This means it has a strong psychological component to it. It has a really strong emotional component. It's not just some injury of your spine or the tissue. It actually involves a more complex set of steps in order to address it and heal it fully. But also another key component of chronic back pain is that it has this quality that's almost like an addiction, almost like a habit. So your body essentially learns how to be in pain. You see, the initial back pain attack, and this is what happened in my case, I believe, is so strong, it's so brutal. Your body probably hasn't felt anything even remotely close to that. So your nervous system starts to vibrate with pain in a way. It starts to send a lot of pain signals, and rightfully so. Like this is a serious injury, so it's trying to notify you, like to take some sort of action that leads towards healing. But often an undesired consequence of this is that the pain continues to vibrate inside of you like for a longer time, and your body starts getting used to it. A lot of chronic back pain is actually exactly that. Your nervous system, your body gets into the habit of being in pain. And this is where painkillers can really play an important role. If you take painkillers early, or even if you take stronger painkillers early in the healing process, immediately after the injury, you're gonna stop your body's pain response, pain signaling. This will probably help you not learn to be in pain so much, and it's probably gonna shorten your healing time. You see, I took mild painkillers initially that didn't really help, and to be honest, I had some bias against painkillers, justifiably. I mean, we all know, we've all heard tragic stories of the opioid crisis, what it can do to people. So I waited a few days before I went to the doctor and I got prescribed painkillers. Once I did got prescribed stronger painkillers, they did reduce my pain levels, maybe for like 2 points, let's just say. They probably took my pain from, if I was at a constant level of maybe 9.5 typically, and keep in mind, like, this is 9 out of 10. This is like killing me all the time. And these like stronger painkillers I got prescribed, they reduced the pain to a constant level of 7.5 maybe, or something like that. So it's still meaningful. I'm still in a ton of pain all of the time, but this is something that's really important when you spend like a week or 2 weeks in pain, and like brutal, vicious pain, and suddenly it only drops even like a level or two. You're like, like, you're so appreciative of that. And again, this is where I believe I should have played it differently. Had I taken stronger painkillers sooner, maybe I would have shortened my healing journey. Maybe I would have reduced the amount of pain my body got used to be, and the whole thing would have been done sooner. But then again, I kept taking strong painkillers for actually quite a long time. I didn't really get dependent on them, but I did. They did become like something of a habit. And as you may discover with a lot of painkillers, they eventually kind of stop working, which is, I believe, it probably wouldn't have made a lot of difference had I done things differently. Anyway, my position is still that painkillers can and should play a vital role in your journey. They are a powerful tool because they can instantly reduce the amount of pain you're going through, which again is very helpful to not let your body learn how to be in constant chronic pain. And look, for some of you, maybe it's possible that painkillers completely eliminate your back pain and you never really go through a lot of it. You never even need to heal in a way. But as a lot of you I'm sure know, painkillers are just a quick band-aid fix in a lot of cases. That's why you'll have to go on the real healing journey, which involves tools that are much different than drugs and painkillers. I'll talk about what those tools are in another video. It probably will pop up somewhere around here. And also, by the way, I have a book that I wrote on this entire journey, what works, what doesn't work for back pain. I documented everything I went through. The book describes how you can develop a personal strategy that's gonna fit your needs and your life. And by the way, it's completely free. Like, it doesn't cost a penny. I just want you to have this because I just wanted to extract at least something good from all the pain I went through. This is entirely for free. I believe it's gonna be a really valuable resource for you. And yeah, like painkillers, maybe they're gonna help you a lot, maybe they won't help you at all. Eventually, you're gonna have to stop taking them. You don't wanna be dependent on painkillers for the rest of your life, which means you'll probably have to continue your healing journey through the other methods. If you're struggling with back pain or another type of chronic pain for that matter, it's probably a good idea to like and subscribe to this channel, share this content with someone else who's struggling with these issues, and also ask any questions in the comments. I'll try to get to them all. In summary, painkillers, not necessarily evil, but also probably limited in their use case. They do play an important role early in the healing journey. You should stop doing them eventually, and you should continue healing through other more effective methods. To know what those methods are, see my free book, completely free. Check the next video in the series. I'll see you there, and until next time, be brave.